So risks of rhinoplasty can be grouped into cosmetic and medical. When we talk about cosmetic, we're generally referring to expectations we feel that either have not been met for the patient or for myself, the surgeon. And generally, at around 8 to 9 months, if we feel that we have not met those expectations together, I will of course recommend undergoing a small revision surgery. But the difference here is that when you do a revision surgery after preservation rhinoplasty, it is uncommon to have to take tissue from other parts of the body or undergo another 6-hour surgery because much of the building block of the nose has been left in sight. And so generally my revisions can be anywhere from 45 minutes to 2 hours, but they're mostly minor tweaks that we're using in order to achieve a better cosmetic result. When we talk about the medical risks, there's a risk of general anesthetic, there's a risk of bleeding after surgery, there's a risk of the blood that's collecting in the septum not being drained, otherwise forming an organized collection called a hematoma. And if that hematoma is unrecognized, the cartilage of the septum may not hold its full structural integrity. There's a risk of adjacent structures like the eyes or the brain being affected during the surgery, however rare those may be. There's a risk that you may not breathe as well after surgery. Generally, we aim to improve breathing for most of our patients, but with swelling or undiagnosed conditions prior to surgery, these may get aggravated and actually lead to worsened breathing. Bruising and swelling are typically not risks of surgery. These are expectations. I do pride myself on being very gentle during surgery. I use my microsurgical instruments from my training in the rhinoplasty surgery to avoid, as best as possible, major bruising and swelling, but this still can happen depending on your age and your general health status. We also use the ultrasound device to mitigate the risk of major bleeding as much as we can. And so I would argue that on average, my patients are recovering much faster from surgery. And when they recover faster, it introduces less variability in the healing process and the potential that scar tissue can form. And so my long-term results have gotten dramatically better over time by using the closed approach, by using preservation rhinoplasty, and by using the ultrasonic device as well.